Restaurant. The new mandate will now require at least one shot for children ages 5 to 11. Meantime, Michigan has a higher rate of hospitalizations for COVID patients than any other state in the country, and that is causing FEMA to request assistance now from the Defense Department. The latest numbers from Michigan show nurses and doctors are taking care of 4,481 COVID patients across the state right now. For some perspective, that's nearly twice the hospitalization rate of 2,400 just 1 month ago. Encouraging news on the number of COVID cases, though, in Michigan overall. That's because the 7-day average has now dropped to 7,000 from about 10,000. Still, though, that virus there killing 118 people every week in Michigan, and that is the highest death rate since January of this year. Newsy's Military Affairs Correspondent Therese Garnier joining us live now from Dearborn, Michigan. That's just outside Detroit. And Therese, you got an exclusive look inside these hospitals. We've been the only network allowed in there. So what role are these active duty soldiers taking, and why has it gotten so bad that they're needed?
Well, hospital staff did give us a sneak peek into the facility where 23 soldiers have been working since Saturday. Now, they are one of 3 teams that have deployed to hospitals across the state as Michigan battles its 4th surge in COVID cases.
The chief nursing officer says due to a shortage in nurses, they are in dire need of assistance. That's where this medical team steps in.
First of all, I'd like to say that I'm very proud of the team here at Beaumont Dearborn, and that includes our physicians, our nurses, and our ancillary staff. But they are tired. They have been through a lot. This is the 4th surge. So bringing the Department of Defense in with us helps give us a fresh perspective.
Army Major Jose Torrijos is an internal medicine doctor from Brooke Army Medical Center in San Antonio, Texas.
This is a very large hospital, has a large number of beds, and they can see up to 100 admissions a day, from my understanding. And sometimes those patients are not able to receive a bed because there's not a bed available upstairs. And so I know that our nursing contingent has been plugged in on the floors to try to open up some more beds so patients aren't waiting hours in the ER to make it upstairs.
Each soldier has a different specialty. Some may work with COVID patients, while others help with other duties. After 2 days of training, they have already begun helping the more than 600 COVID patients in the hospital. Of that number, 22% are vaccinated, while the other 78% were not.
So what I think is important for people to understand is that the vaccine doesn't prevent you from getting the disease 100% of the time, but if you do, it's not as severe. And so in my limited experience, what I have seen is that they spend, instead of spending 2 weeks, they might spend 2 or 3 days. Instead of having to be intubated, they need a little bit of supplemental oxygen and sometimes can go home and just be followed up as an outpatient.
He and his team are here for at least 30 days, but he says they are happy to extend if the hospital requests it.
At this point, our infection prevention department is watching Omicron very closely, and we're seeing what we have to potentially change.
Now, as of Sunday, nearly 4,500 people are in hospitals like Beaumont seeking treatment for their COVID symptoms. Now, with cases of the new variant Omicron popping up across the country, there's no telling when it'll pop up here and what impact it may have. Back to you, Rob.
Newsy Military Affairs Correspondent Therese Garnier live in Dearborn, Michigan with exclusive hospital access there. Thank you, Therese. Coming up, a once abandoned policy now